we've got to remember, and we see this in other parts of the world, it's not over yet. This virus continues to pose a major threat, and it is likely that it will do so for some time yet to come. And so it's fair to say that we still have a lot more work to do. But it's also important to remind ourselves of the progress that we've made, and to do that, to remember the situation we were in 3 months ago. Back then, COVID-19 was out of control. It was spreading exponentially. There was a very real prospect that our health service would be overwhelmed, even with the extra capacity that we had created. And back then, that was a daily worry for me as First Minister, for the Chief Medical Officer and the Health Secretary. And back then, none of us knew for certain how the country would cope. Today, we are in a very different position, as the numbers I've just reported demonstrate. Hospital admissions, which at one point were totalling 200 a day, are currently in single figures every day. As I've already mentioned, the number of people in intensive care has fallen by more than 90%. And while it is absolutely the case that one person dying from this virus is one too many, we've also seen a very significant and sustained decline in the number of deaths. And though demand was high at points and the pressure on NHS and social care staff extreme and remains extreme, at no point during this did our NHS come close to being overwhelmed. All of that progress is, of course, a direct consequence of your efforts and your sacrifices.